I'm Dr. Ken Alleyne, a local orthopedic surgeon. Grew up here locally. Went to Williams College after graduating from Kingswood Oxford School, Wake Forest University then for my medical school training, and then Howard University Hospital for residency. During my training, I had the good fortune and opportunity to win a research fellowship at Harvard MIT Division of Health Sciences, where I worked on issues of cartilage repair and regeneration. And then went to Yale University, where I did a sports medicine knee and shoulder fellowship, which is primarily what my practice is now, problems of the knee and shoulder, as well as sports medicine. I've always enjoyed working with my hands, and I also enjoy the immediacy of working with patients who have knee and shoulder problems. I mean, they don't have the ability to lift or to run, or in my active seniors, even to be able to walk well. And through your interactions, whether it be non-operative or operative, you have the ability to kind of restore function, which is a very satisfying aspect of my job. Our motto, Eastern Orthopedics and Sports Medicine, is commitment to great care. And so that's really our focus. It's a very patient-centric, patient-focused care model. Now, what does that mean? That means that we expect our patients to get as much time as they need to explain what's happening, that their needs are met and their concerns are heard, and that we work together collaboratively in developing a plan of care to restore you to the level of function that you desire. My practice focuses largely on arthroscopic procedures of the knee and shoulder, as well as total knee arthroplasty. So it's very rare now for me to have to make a real incision for anything in the knee and shoulder outside of a knee replacement, and even those we're doing through very, very small, minimally invasive incisions. And I think that's one of the differentiators of our practice. We really focus on non-operative first, but when necessary and patients require surgery, to figure out the most minimally invasive way to get a good result, get a good outcome, and restore their function. My training was a lot in very large universities, so I didn't get exposure to a lot of community sort of care, but to really be part of a community, to have a community that believes in its local physicians and wants to be seen by them is really a wonderful, wonderful thing. I do majority of my practices at Rockville General Hospital. I do some at Manchester. But in terms of a place that really feels as if it's an anchor in a community, and to be able to see the patients that you work with out, whether it be at the gas station or at the coffee shop or in the mall, is really quite rewarding. I enjoy a great deal of volunteer work in the local community, both east and west of the river. My focus and the focus of my wife and I are largely on issues obviously surrounding healthcare and kids. So I participate as a commissioner on the Connecticut Commission on Health Equity. I served on the board of the Community Health Services and involved with many mentoring programs locally for children. I also do a lot of volunteering for athletic programs around the world. So I'm involved with the United States Olympics, and I just finished being one of the doctors for the United States Tennis Association at the US Open. So I enjoy a lot of volunteer time surrounding what I do in sports medicine.